Hi, everyone. We just finished our third annual EGFR Resistors Research Summit, which took place on November 14th and 15th. For those of you who don't know about the EGFR Resistors Research Summits, for the past 3 years, we've brought together young investigators from across the United States who are doing work related to EGFR positive lung cancer. This year, we had 17 young researchers from diverse locations across the country, as you can see on the map on the screen. While the young investigators give presentations on the research they're working on at the summit, the details of a lot of this work is confidential because it's work in progress that hasn't yet been formally presented at an oncology meeting or published in a journal article. So the true value of the summit isn't necessarily hearing the details of this work. It's the development of collaborative relationships between the young investigators and our mentor judges, who are well-known knowledge experts in the EGFR positive lung cancer community. The young investigators get feedback on their work from these judges and also receive mentorship from them in many important topics like grant writing and social media and how to interact with pharmaceutical companies and just when to say yes and how to say no about things that they're being asked to do. So it's a great experience for them. This is the second year that we've needed to do our summit virtually, and we've managed to create a very positive virtual community experience through sending our participants conference packages ahead of time with EGFR Summit sweatshirts like the one I'm wearing and some other items. We've created Zoom backgrounds, that get everyone in the mood and feel like they're together. And we even this year had a fun night of trivia at the end of our first day of the summit. So the EGFR resistors hope that the creation of these relationships and the sense of community that's developed through the summit encourage our young investigators to continue their work in lung cancer, especially in EGFR positive lung cancer. And we give winning presentations, monetary grants for their institutions, which we hope will create excitement and attention for their work and lead to additional future grants. So now Dr. Stephen Liu, one of our mentor judges, will talk about some of the really interesting research and award winners from the summit.
Thank you, Ivy. Jill, Ivy, I thought this meeting was fantastic. We saw projects focused on all aspects of EGFR mutant lung cancer, and all of the participants were enthusiastic, were engaged, were energetic, were interested, were so talented. It really was just a joy to be a part of this. And to reinforce the point you made, I can't divulge all the details of their very interesting and ongoing work. I do want to highlight the projects in some general terms, just to show everyone some of the very important work that's being done, and also to celebrate and congratulate all the participants. We had Dr. Michael Grant from Yale University, and he focused on specific subtypes of EGFR lung cancer. One of the things we've learned over the past few years is EGFR mutations are not present or absent. There's a lot of granularity with that, and the specific mutations dictate the biology, and maybe in the future, they'll dictate the treatment as well. We're already starting to see that with some of the less common EGFR mutations with exon 20 insertions. What Dr. Grant did from Yale University was look at a specific type of EGFR exon 19 deletion. What some of us may not realize is that EGFR exon 18 deletions are not one mutation, it's really a family of mutations. He honed in on one of the specific ones where L747 to A750 are deleted and replaced with a proline residue. And his work really suggests maybe different clinical outcomes in that subset. And so these tiny differences matter. I think everything matters. We just need to understand how that matters. And that was some very important work that Dr. Grant was doing. From UT Southwestern Medical Center, Dr. Mitchell von Itzstein looked at a different mutation, EGFR L747P. And he really discussed this rare mutation, explaining what makes this mutation unique and maybe outlining some different treatment strategies for this specific subtype. Uncommon mutations outside of exon 19 deletion L858R are also actionable, and we have an FDA-approved drug there, a kinase inhibitor called afatinib. Dr. Jane Sui from Memorial Sloan Kettering discussed a prospective clinical trial of afatinib, a second-generation EGFR inhibitor currently approved for that mutation subtype, plus ramucirumab, an agent targeting angiogenesis by blocking VEGFR2 in these specifically uncommon EGFR mutant non-small cell lung cancer subtypes. And Dr. Yin Rex Hung from Massachusetts General Hospital looked at a slightly different subtype. He really provided characterization of EGFR mutant lung cancer specimens that harbored any evidence of neuroendocrine differentiation. This is really looking at it from a pathologist perspective. And one of the real nice things about this conference is it was multidisciplinary. We had a lot of different specialties here. And looking at this from a pathologist standpoint, we focus in on the genomics, on the presence or absence of an EGFR mutation. The pathologist can see differences, phenotypic, microscopic differences. Most EGFR mutations are present in adenocarcinoma or non-squamous, non-small cell lung cancer, but he was looking for any evidence of neuroendocrine differentiation, and do those have an underlying different biology? Very important work. Most of our patients, unfortunately, as it stands now, are diagnosed with stage 4 lung cancer in the US, but we can detect earlier stages in the stage 3 setting. There's a lot of debate about how we should optimally treat this. And we had 2 very important abstracts here. Dr. Neil Chudgar, a surgeon from Montefiore Medical Center, discussed the use of neoadjuvant targeted therapy. And that refers to targeted therapy before surgery, not the standard approach, but a very promising one, and really thinking outside the box for stage 3 non-small cell lung cancer. And Dr. Jacqueline Aredo from Stanford Cancer Institute looked at outcomes for patients who received targeted therapy before chemoradiation for locally advanced lung cancer. Chemoradiation, a potentially curative modality, can targeted therapy improve upon outcomes in that subset. So very interesting work. For patients that do have stage 4 disease, we're fortunate enough to have very effective targeted agents. And our current standard would really be the 3rd generation kinase inhibitor, osimertinib. We had a little bit of work presented here looking at patients receiving osimertinib. Dr. Hollis Foray from Beth Israel Deaconess Medical Center provided a real-world study of outcomes with first-line osimertinib in EGFR mutant lung cancer. Real-world analyses critical to moving the field forward, but this specifically looked at patients that would not have been eligible for FLAURA versus those that would have been eligible for FLAURA. Do we see differences in those outcomes? In all of our clinics, mine included, not all our patients are eligible for it, and some of them are clinical reasons, organ function, performance status, but others are a little more technical, maybe a slight EKG difference, something we don't really consider to be too clinically relevant. Do those impact outcomes in patients receiving these targeted drugs? Very important work. And Dr. Karen Yoon from University of California, San Diego, prevented outcomes from patients with EGFR mutant lung cancer who received chemotherapy before targeted therapy. I know you're thinking we don't usually do that. We go with targeted therapy first, but in the real world, sometimes you need to start treatment now before you have all of those results. And very often we'll start chemotherapy in that setting, not immunotherapy, but chemotherapy in that setting. What do we do after that when we get those results later? And how does the sequence of events and the timing of targeted therapy impact outcomes? Fascinating work. While osimertinib is a very effective treatment, responses are common, they're deep, they're fast. Unfortunately, we very frequently encounter resistance. And a lot of our work at this summit looked at resistance. Dr. Alyssa Cooper from Massachusetts General Hospital provided research on acquired resistance to 3rd generation EGFR kinase inhibitors, not just specific mutations, but really pathways that are engaged. Because these pathways, these escape routes that cancers are using, these are potential contexts of vulnerability. These are potential targets that we can go after. Dr. Nicole Yoon from Rush University used RNA sequencing to identify some of the other pathways that are upregulated in the presence of these EGFR mutations, and perhaps these can be rationally co-targeted with EGFR inhibition. And so laying the groundwork for future therapeutic strategies. Dr. Inez Pulido from University of Illinois at Chicago provided research on metabolomics, an emerging field, and specifically in EGFR mutant lung cancer. She looked at 1-carbon pathway metabolites to really implicate new, potentially druggable targets that are at play in EGFR resistance, meeting in an epithelial to mesenchymal transition, looking at really new targets that I think are very exciting. Dr. Manish Thiruvalavan from Cedar-Sinai Medical Center described upregulation of endoglin expression in TKI-resistant EGFR mutant lung cancer and gave us a glimpse at a potential drug that can target these resistant cells. And so a lot of promise and prospects for the future. Dr. Salsan Rashdan from University of Texas Southwestern described a trial of osimertinib with stereotactic ablative radiotherapy, or SABR. Can we integrate radiation up front, not just at the time of resistance, but in the beginning as an early consolidation to help improve long-term outcomes? These are all exciting opportunities to better understand and to overcome resistance and maybe to prevent resistance. Another area that was of interest at this summit was immunotherapy. And historically, we've seen that immunotherapy, while exciting for a lot of patients with many different types of cancers, in EGFR mutant lung cancer, it has been disappointing. Responses can occur, but they're not common. And we need to understand that process better to deliver those long-term immune-mediated responses that we want in EGFR mutant lung cancer. What are the barriers? How can we understand that? What we saw here from Dr. Sumit Mukherjee from Albert Einstein College of Medicine, he gave research on ART1. This is a protein that interacts with the tumor microenvironment, and through a process called myelination that induces immune suppression. Can we target that to unleash immune responses? Is it different from person to person? These are fascinating questions. We also heard from Dr. Joshua Royce discussing a new immunotherapy strategy in EGFR mutant lung cancer. While we've seen some early promise from chemotherapy with atezolizumab and bevacizumab in the Empower 150 study, there are some questions. Do we need the chemotherapy portion? Exactly what changes are being induced by the anti-angiogenesis by targeting VEGF? And can we build upon that? He presented a prospective phase 2 study of tiragolumab, an anti-TIGIT antibody that has fast track designation in non-small cell lung cancer, looking at that in EGFR mutant lung cancer in combination with atezolizumab and bevacizumab in TKI refractory EGFR mutant lung cancer. We also had a focus on survivorship and on communication and how to better our practices in the clinic. And Dr. Laura Petrillo from Massachusetts General Hospital provided results from a qualitative study looking at patients with advanced EGFR mutant non-small cell lung cancer receiving targeted therapy focused on communication regarding prognosis, an area that we can all improve upon, really our listening and communication skills, critical to improving survivorship patients with EGFR mutant lung cancer. And Dr. Elaine Shum from New York University Perlmutter Cancer Center described a trial of screening CT scans in female Asian never smokers. I thought this was fascinating work. We know that low-dose screening CT saves lives, decreases lung cancer mortality in patients with a heavy smoking history. But we also know that there are many lung cancers that are not related to smoking, and patients that have no history of smoking that develop lung cancer. We need to understand this better. Her study is really looking at moving that screening CT scan into a higher risk Asian non-smoking population, gathering information, try to better understand that. I thought that was really fascinating work. And I think you'll agree, Jill, really an area of need where our focus has been on smoking-related cancers, but not all cancers are smoking-related, and we need to identify all of these cancers earlier. I thought that was a really important study.
Yes, I think it's a very important study too. And I think it's that first step in looking at how do we identify people to screen who don't fit within the current guidelines. And I think it's also an important step because biomarker testing in early stage lung cancer is becoming something that clinicians are ordering so they can offer adjuvant therapy to their patients with targeted therapies. So I do think it's really important. I think she has done a fantastic job already in getting this off the ground. I'm really excited to see where she takes it.
I completely agree, Jill. And we all found this work to be so impactful, I think so important to moving the field forward, that Dr. Elaine Shum was the recipient of the Distinguished Young Investigator Research Award. She is our overall winner for lung cancer screening in female Asian non-smokers, exploring screening in a high-risk population. And so congratulations to Dr. Shum, and thank her for all the important work that she's doing. We had several other awards that were handed out. Our first runner-up in the general session was from Dr. Petrillo for her work on prognostic communication. Our second runner-up in the general session was given to Dr. Manish Thiruvallabhan. I'm really looking at restoring therapeutic efficacy by targeting endoglin. In the breakout sessions, we had 2 separate sessions and 2 separate winners. Our breakout session 1 winner was Dr. Yin Rex Hung, looking at those neuroendocrine EGFR mutant lung cancers. And our breakout session 2 winner was Dr. Joshua Royce, looking at the immunotherapy strategy in EGFR mutant lung cancer targeting TIGIT, VEGF with PD-L1. And really that immunotherapy strategy, I think, really important to the field. Ivy, I don't know if you have other comments on developing immunotherapy in this setting.
I thought Dr. Royce's project was particularly exciting for a couple of reasons. I mean, I know that there has been a little disappointment among EGFR resistors members that there isn't any great way as of yet that's been discovered to incorporate immunotherapy in our treatments. And this is just such a new way that sounds so exciting that he's working on that, you know, might possibly help us. So I'm looking forward to hearing more about it. I also think that one thing that's really cool about his trial is that one of our EGFR resistors members, Dan Wanzer, actually was an advisor for him in terms of setting it up and, you know, giving him advice on what patients might want and need to participate in the trial. So we're happy that he was able to help in that respect as well.
Yeah, I think that has to be the model going forward. We have to really integrate involvement from all stakeholders, and I was really happy to see that as well.
Yes, definitely. It's patients as partners in research. So as you all heard, it was a very exciting research summit. And I just want to talk about a couple of things that we added this year. There were 2 guest speakers, and one of them you may know, Chris Draft. If you don't know Chris's wife, Keisha, died of lung cancer about 10 years ago. And Chris continues to be a fierce advocate for survivorship and research. And so this morning, he started the day by talking to us about what role researchers and clinicians can play in advocacy for both the patient and the cause. He also encouraged everyone to challenge the norm and use their voice to fight for health equity, and mentioned that building relationships was truly one of the most important parts of this community. And it's true, both medically speaking and within the advocacy community. And of course, as always, he, really emphasized that survivorship should always be the priority. So we're grateful for that. And then Dr. David Johnson from UT Southwest, he talked to the group about the qualities and practices of a successful researcher, but he really provided sound and wise advice on what to think about when choosing an area of research, what to look for in a mentor, and the importance of work-life balance, which they're all important aspects of having a successful career. And I found a lot of what he said could apply to our lives as advocates or whatever career we are in. He was such a pleasure to listen to. He was actually really funny as well. But his advice would benefit everyone. So he was really a great addition. And while the event was virtual this year, we are very hopeful, and it is very promising that next year's Research Summit will be in person. And we've already talked about a reunion for all the past awardees who can come to the summit, give us updates on where they are in their research, possibly help mentor some of the young investigators, fellows that are participating. And they could also talk about how this research summit has helped them both in their career and personally. So we're really excited about that. And we've already got the wheels in motion, starting to plan for next year. But I just want to end by thanking all of our young investigators for the work that they're doing. We want to thank our mentor judges, especially you, Stephen Liu, for coming in and helping us this year, but all of them for their support, their unwavering support for our community, and always stepping up to help in any way that they can. We are so grateful for them. We are grateful for AstraZeneca for their continued sponsorship of this event. We wouldn't be able to do it without them. And of course, CC Oncology, Joni and team, for your creativity, your tireless efforts, and your amount of energy that you put into making this a successful event. We thank you from the bottom of our hearts.